Hi, everybody. I just want to welcome you in as I'm going to let the audience come on into our presentation. So we will begin promptly in about a minute. All right, well, hi, everybody, and welcome to Operation Parents webinar, Shedding Light on Opioids. Our presenter today is Arlene Rice, and she is the founder of the Gabriel Project 930 and author of the book, Parent of an Adult Addict. My name is Mary Beth Huberti, and I am Operation Parents Director of Program Development. We are very happy to have you join us today for this 45-minute webinar. Before we get into the content, I would like to go over a few of the features of the GoToWebinar panel so you can fully participate in this session. So as we go ahead and get started, I'd like everybody to take notice of the orange box at the top of the GoToWebinar panel. It has a little arrow in it. That's your orange grab tab. If you click on that, that'll minimize your GoToWebinar box. And if you click on it again, it'll open it back up. So it just allows you to fully view the entire page. So if you want to go ahead and just open up your panel so you can see all the different portions, that would be great. So next we'll move to the question feature. All attendees will be muted during this presentation. We would, however, like to hear from you via the questions section. About halfway down the control panel, you will see this section. You can send and receive both questions and comments here. There are 3 panels. The top panel will show you any questions that have already been posted, and below that is another light blue panel where you can type in your questions and then send them to the staff. So we're just going to go ahead and try this out. So I'd like everybody to go ahead and click into that second panel and just send me your name and where you are joining us from. Make sure you click send to staff when you are done typing so we can see your response.
Hello, Liz. Maria, thanks for joining us. Cynthia from Ohio, glad you're here. Robin from Oregon. Linnell from London. Courtney, thanks for chiming in here. Carl, awesome. Rashida, Ashley, we see ya. Brenda, thanks so much for joining us. Jamie from Kansas. Laura from Florida. Sam from Louisville. Josh from London. Nikki from Cape Girardeau. Stephen from Philadelphia, Justin from Edmonds, Washington, Kim from New York, Danny from Las Vegas, Cameron from Washington State. Hello, how are you doing? Great. Thanks so much, you all. We're glad you're here with us.
Okay, thanks, Michelle. Michelle will be handling the questions today. So as I mentioned, if you have any problems during the webinar, whether it's listening to it or viewing it, go ahead and send the questions to our staff. Michelle will be handling those. At the end of this presentation, we will address any kind of questions that you may have in particular for Arlene. So go ahead and send them at any time. And as I mentioned, we will run about 40 minutes and then take the last 5 minutes. We may go over the 45-minute mark for finishing off any questions. Okay, below the questions section is the handouts. You will notice that we have loaded 5 handouts to this webinar, and they are how paraphernalia and drugs are hidden, shedding light on opioids, and that's your web resources, heroin, fentanyl, and other opioids, your child's treatment roadmap, and then the shedding light on opioids presentation. That's the PDF of this presentation for your handouts. Now, please take the time now to double click on the handouts to begin the download process. The handouts will only be available to you while we are in session. Once the webinar has ended, the session is closed and you will not be able to download the handouts. So again, I just encourage you to do so now. We are recording this presentation and this recording will be sent to you tomorrow afternoon. You will receive a second email which will contain the handouts. So for any reason you're attending on your phone or you are watching the recording, you need to look for the second email and I will attach the handouts there also. So also to keep in mind, if you're attending this event live, there will be a short survey sent to you directly after the webinar. It takes about a minute or two to complete, and we would appreciate your feedback through that survey. So right now, what I'd like to do is go ahead and turn over the presentation to our presenter, Arlene.
Thank you. Thank you, Mary Beth, and thank you, Operation Parent, for inviting me to be here today to present on shedding light on the opioids. So, but before I get started, I want to begin by sharing a little bit about myself and why I do what I do. I am a parent and I have 4 adult children. 3 of my adult children have a substance use disorder. 2 of them are in recovery. I have a son that's 2.5 years in recovery. He has overdosed multiple times on opiates. He has been revived several times with Narcan. He has used substances of some type for over 30 years. So he is 2.5 years in recovery. We are just so thankful for that. He is now a peer specialist and working in a recovery program to help others. I have a young daughter who's 30 years old, and she's 4.5 years in recovery. I wrote a book about her, parent of an adult addict. I found her in my basement, overdosed on heroin with a needle still in her arm. But she is in recovery today, and thank God for Narcan and for those that have helped revive her. And then I have another son. His name is Gabriel. He overdosed on 3 different occasions. The last time he overdosed was in 2013. It was a combination of alcohol and heroin, and he was actually in the sober house when he overdosed. 4 days later, however, Gabriel died. And so I've learned a lot on this journey since Gabriel's death. I've learned I did a lot of things wrong. I moralized his addiction. I thought detox was recovery. I thought a sober house was a recovery house. And here I was, an anatomy and physiology professor, and I didn't know how to help my son. So I've been on this journey for the last 5 years to educate parents and to educate communities about resources and about the epidemic as well. So with that being said, we'll go ahead and get started and look at our learning outcomes from today. We're going to review some behavioral trends that we are seeing in teens. We're going to identify different types of opiates and other drugs, recognize signs and symptoms of using, and then spend quite a bit of time of where do I go for help and how do I get help. And when you look at behavioral trends at the next slide, we're looking at adolescents, particularly right here, 12 to 17 years old. And this is from SAMHSA, the Substance Abuse Mental Health Services Administration. And in 2015, there were over 250,000 adolescents that were current, what we call non-medical users of pain relievers, meaning they were using them recreationally and they didn't have a medical prescription for them. And 44% of those had an addiction to pain relievers. 8% had used heroin, almost 2% are current users, and a little bit over 2% had heroin use disorder. But those numbers, like I say, are changing constantly. Here we are in 2018, and the numbers keep rising. So we're going to look at, one of the things we'll look at today is how the prescriptions of opiates and opioids, how there's this connection between heroin and prescriptions. There are studies that have shown that early exposure, like preteen, to prescribed opioids can lead to addiction in teens. And 9 out of 10 start out with pain pills, which can lead to this progression to heroin. So one of the goals is to help you see that there is a connection between opioid prescription medication and the possible progression to heroin. And anymore, it's the pendulum's even swinging away from heroin. It's more fentanyl now. So that's an ever constant change that's going on in the addiction community. So even if just say your child or your teenager has a prescription and it was prescribed for a legitimate reason, for an injury or surgery or whatever, that there is always this potential that they can become addicted. So we're beginning to look at different ways that we can use something besides opioids to help control pain. When you look at when you look at this statistic here, this again is from you look at the recent percentages among the past year and the users here, and why are they using the drugs, and where are they getting? If you have 12.5 million people aged 12 or older who have misused prescription pain relievers, how are they getting their hands on the medication? How are they getting it on the opioid? Well, 54% have either been given to them, bought it from, or taken from a friend or a relative. 36% has been through a prescription from a physician or a legitimate reason, or maybe they've stolen it from a healthcare provider, and 5% bought it from a dealer or a stranger. So that's why we really push for cleaning out your medicines, disposing of your opioids, anything that's unused, because people are stealing them or taking them. Now, when you're talking again about prescription medication and the new step in the drug ladder, which is our next slide, kids normally start out, teenagers, usually they are high risk, they have behaviors. They're going to start out with cigarettes. They're going to start out with alcohol. They're going to start out with marijuana. But before you had this prescription drug abuse, before that became prevalent, it was really a huge jump to go from alcohol to cigarettes, to jump up to something like harder drugs like heroin or cocaine. But now that you have this prescription experience, that facilitates this easier transition in the progression. So when you look at exactly how that happens, first you become addicted, in the next slide, to prescription pain medication. And then you have this progression when your brain in the midbrain begins to deplete the neurotransmitter dopamine. You're going to want this more powerful, stronger high. So that person is going to begin to crave that high because of that reward system deep within the midbrain. And then that craving leads to a search for a stronger and a more powerful high. And so for many, what happens is that search will eventually land them on heroin or fentanyl. In some areas of our country, you can actually buy heroin really, really cheap, as opposed to buying a pill for $40 or $60, when you can get heroin or a bag of fentanyl or something for like $5 to $12 a bag. Once you become addicted, and once you have that, you're going to be looking for ways. That person is going to be looking for ways to cut down on the cost, because they're going to need this every day. So that's why people a lot of times will switch and go right to heroin. Now, it doesn't necessarily have to be IV use. You can snort it, you can inhale it, and also, of course, just take the pills. So, but while we're shedding lights, and how are you going to spot those opioids? What do you know what to look for? And so this slide here is, I tell parents, if you find pills or you find things, look at the markings that you're finding. And when you look at Oxycontin or Opana, or the lower tabs that you see there on your screen, those are going to have particular markings. And you can even Google these if you find a pill or in the possession or in your home and you're not quite for sure what it is. For instance, that Opana with the E61310, you can Google that. It'll come up and identify that as Opana. Now, the other things that you'll notice here is in the left-hand corner there. This is just for your information. Some of you may be familiar with this, but that's heroin. What's on the left is black tar. What's in the middle is brown mud. And what's on the right-hand side there of the heroin is white china. And then on the right-hand side of the screen, this is legitimate fentanyl that you can get. There are people that have cancer that have fentanyl patches. There are people that are in the hospital that receive fentanyl intravenously after a surgery, let's say, to help control their pain. So the fentanyl that you see that is killing people is not the same fentanyl that's controlled by the FDA or within a controlled environment. The interesting thing about the patch is people that become addicted to opiates or opioids can peel back that patch, take the fentanyl off of it, and stick it on their tongue and use it sublingually. That is a way that people have stolen or taken, patches from their grandparents or people who might be on long-term chronic pain therapy. And the codeine that you see there, we used to buy that over the market. You used to be able to go to the drugstore and get that. And if you look at that bottle in the middle, that's a bottle of heroin. Bayer made heroin in 1898. That's how long it's been around. But again, this is just for your information. The heroin that is on the street, the fentanyl that's on the street, is not the same thing as what we're seeing here. Now, the other thing that's interesting, you might ask yourself, how are people getting this into their homes? How are they hiding it? And I tell parents all the time, and I tell people, they are really hidden. If someone is using an opiate or an opioid, they will have that on their body or in close proximity 100% of the time. In their socks, in their bras, in their panties, in their pockets, under mattresses, in toilet tanks, taped to their leg. My son taped his to his leg, behind cell phone batteries, dressers, and clothes, and in the side of a water bottle lid, just different things. If your child, if you suspect that they're using, they're going to have it in close proximity somewhere. The drug will begin to wear on them, and you'll begin to see signs that they are using. So that's one way to spot them, is just to know if you find anything, just to go ahead and Google it. The next slide is really, really interesting. This kind of gives you a comparison. On the left, you see that's heroin. That's 30 milligrams of heroin. Then you see the fentanyl. That's 3 milligrams. And then you just see that tiny, tiny bit of carfentanil. Each of these doses is enough to kill an adult male. Look at that little bitty carfentanil there. That's called the elephant drug. That is a tranquilizer they use for elephants and big and large animals. So, like again, fentanyl was originally used as an anesthetic, but again, it's made its way to the street, made its way from China, from Mexico, all the way up to where we are in the United States. So just know that they're very, very potent, and that fentanyl is the prevailing drug right now over heroin. Now, when you talk about warning signs of drug abuse as we progress on here, there are going to be some things that you're going to see. There are going to be some little red flags that are going up, some warning signs, so to speak. Not any one in itself will stand alone, but when you begin to see different things like changes in behavior, personality changes, health problems, personal appearance, those should cause you to have a red flag go up in your head. The first change is usually behavioral. It's one of the first visible signs of drug use. Some behavioral changes that might indicate that your child or someone you know is using is they may begin to really perform poorly in school. They may begin missing their extracurricular activities, maybe getting into conflicts or getting into trouble. Maybe teachers are starting to say, hey, there's something going on here. Maybe they've had some illegal activity or behavior. They're not as interested maybe anymore in their hobbies that they once were. Maybe they love soccer or piano or guitar or whatever. Maybe they've changed their friends or their social circles. But one of the big things that you'll see in the change of behavior, this is always so true, is isolation. They will isolate themselves from family, from friends. They may act secretively. They may demand privacy more so than usual, a lack of respect for authority. Often they will avoid contact with you. They can become defiant, uncooperative, hostile, all kinds of things like that. But monitor and check your child's possessions and their online activity, especially if you notice that they're having a change in behavior. Now, with their personalities, you're going to see some mood swings, maybe some emotional instability, extreme highs or lows. Opiates usually make you really, really drowsy. Sometimes you'll have a period after that where you'll have a lot of high energy. So just know memory problems, poor concentration, slurred speech is a telltale sign of opiate use as well, usually. And then when you're talking about health problems, a lot of what I used to see in my kids were their appetite changes. They'd lost a lot of weight, they couldn't sleep, or then they were having hypersomnia where they were sleeping all the time, nausea and vomiting, headaches, sweating, different things like that. Runny nose, shaking tremors. Now, this is an interesting slide here. I love this slide because I didn't know this. I didn't know how opiates and opioids affected your eyes, but I always tell people now, your eyes do not lie. Eyes don't lie. On the right side of your screen, you see what we call a constrictor pupil. The pupil is the black point in the middle of the eye right there. And on the left-hand side, you see that it's really, really dilated. When someone is using opiates or opioids of any kind, always 100% you will see a constricted pupil. Now, on the left-hand side, the dilated pupil, that could be from any number of things. It could be from withdrawing. It could be from going into a dark room. It can be from using meth or having high anxiety. But the thing about opiates and opioids when you use and how it changes the eye is that pupil doesn't change. When you walk into a room, you and I, our pupils will change, either larger, dark, smaller, larger, whatever. Someone that's using opiates, their pupil will not change. It will stay consistently small, no matter the light, no matter the darkness. So I got to a point at one time where I began to look into my children's eyes as I began to observe, some of their behavior and observe their physical appearance. So just know that the eyes don't lie. Another symptom has to do with drowsiness. Now they call this nodding off, but looking sleepy. That can be a sign if you're in the, maybe they have droopy eyelids. I have seen people that have been on opiates or opioids, well, they'll be standing and actually just stop and begin to nod off. That is just what they call a really a high or nodding off. That's really common in opiates as well. The other thing that is common that you will see, and this has to do what we call a histamine release, the symptom of sneezing or the symptom of a runny nose. Sneezing more than usual can be a sign, as well as the sniffling or the constant runny nose, because of the histamine release. I do know this. I remember my son Gabriel telling me one time that, about a year before he died, he would be sneezing and he'd say he recognized that he also, when he would begin to withdraw, that it would take him about 3 days before he needed another, some more opiates, but he would begin to sneeze constantly. So that's also another sign, from what I understand, of withdrawal. Scratching or picking hair off the hands is another one that has to do with the histamine release. All of my kids that were opiate users, none of them had hair in their hands, and they were constantly picking, again, scratching, picking the hair off the hands. That's a sign. Now, the tiny pricks on the arms, usually you won't see it so much like this as you will maybe just one particular area, that one vein that they might be using for a while. You might see might look like a really, really tiny scab. I know when I have seen them on my child's arms, I say, what did you do? And they'll say, oh, I bumped it into something more. But it's always within a vein on the arm. But also know, people don't just inject in their arms. They inject in their legs, they inject in their thighs, their neck, their feet, under the fingernails. So you might see a prick or two, or you might not see anything, because they might be doing it in between their toes. But just know, if they're using intravenously, they may wear long sleeves or long pants, but you're going to see some signs there as well. Look at the neck too. The neck will have some marks on it as well. All of these right here related to opiate use. That whole top line has to do with intravenous use. The second line mostly has to do with inhaling or snorting or sniffing. And the last line has to do with intravenous as well. But what does a bottle and a spoon and a lighter and a Q-tip and a balloon have to do with opiate use? Well, I would constantly see my children that were opiate users with a bottle of water, but it was hardly ever gone. Or I would find the bottle in the bathroom, or I would find a burned spoon in a drawer. And what people do that are injecting, they will put it on the medication on the spoon, put the water with it, mix it up, light it, dissolve it, and then use to pull off the cotton of the Q-tip and pull it up through the needle, so that cotton tip acts as a filter. The danger in that is the fibers, that if they're injecting, they can actually get into the vein and cause some type of an embolus. So, as well, the one thing I did not know about was the balloon. I would find balloons like this that look flat in awkward places in the house, like in a box that I never opened, or in a drawer. And what I later found out is the balloons actually is where they put the heroin in. and it's a marking usually of whoever the drug dealer is. Sometimes they'll have a stamp on it, but I would go and see it, and then the next day go look for it, and it would be gone. That's because the heroin was inside the balloon. I know here in Louisville that they've had some Mexican people that they would put the balloons in their mouth, and when they would deliver the drug to that person who was buying from them, they would take the balloon out of their mouth. So anyway, just know that if you find weird balloons or cotton tips on the floor or bottles in your bathroom, burnt spoons or even spoons missing, that is probably a sign of opiate use. The nasal bottle there, they can say, hey, I've got a sniffly nose and this is might be Afrin, whatever they're saying, but they're using that. The straws, I used to find a ton of straws cut in half, pins hollowed out, aluminum foil would go missing. What happens with the aluminum foil on the toilet paper roll is the opiate can be burnt and mixed in on the aluminum foil, and then as the fumes come up from that, as it's cooking on the aluminum foil, they can inhale that. The razor, of course, and the mirrors, that's how they divide it and cut it up. I used to find ties and my shoestrings missing and belts in different odd places. Those are used as tourniquets. There's so much more to this, but just know that if you're seeing odd things, that that's just might be a cue that something's going on. Now, how do you recognize an opiate overdose? Would you know what to do? Would you know how to recognize that? And so I tell people the biggest thing about an opiate use, of course, you're going to have the pinpoint pupils. When you're really high, you might be really relaxed and you're going to have some slurred speech. You're going to possibly be nodding off, have really pinpoint pupils. But the difference is you're going to be able to shake that person, yell their name, shake them on the shoulder. Hey, are you awake? Are you okay? And they wake up. Now, an overdose, what's different is that they're not going to respond. Now, they might be breathing, and it might be slow, or it might be irregular, or it might not be any breath at all, but they're not going to be able to respond. There were some stories. I tell people this whenever I do training: deep snoring or gurgling or wheezing. Don't think for a minute that because somebody is snoring deeply that, hey, they're okay, they're just sleeping it off. People have died that way. Because their friends thought, well, hey, we thought they were sleeping it off, when actually what had happened was their tongue was blocking the airway and they ended up dying from hypoxia and their heart stopping and cardiac arrest eventually. Blue and gray lips and skin. I know when my daughter overdosed, she was already blue when I found her. Her fingertips were blue. She was blue all over, but also this grayish color. Sweaty, clammy, she looked dead. I did do rescue breathing on her, so she was still gasping for air when I found her. So I knew as a nurse, I still needed to breathe for her, but she didn't respond. So anyway, just know the difference between an opiate use. Now, if you are not for sure if it's an opiate, you still go ahead and breathe for them. With other drugs, you're not going to see, like with meth or with cocaine, you're not going to see the suppression of breathing. You're most likely going to see cardiac symptoms like tachycardia or a fast heart rate, chest pain, things like that. Opiates always cause the central nervous system to be depressed. Now, when we're talking about professional help, what are you going to do? One of the things I did after my son died is that I contacted a parent addiction coach. We didn't have any in Kentucky, so I started looking. And I came upon this guy in Arizona who was a professional parent addiction coach. And he also had founded PAL groups, which is Parents of Addicted Loved Ones. So I thought, I'm going to call him. I still have 2 adult children that I don't have a clue what to do with, and I don't want them to die. So he coached me over the phone and helped me to deal with their addiction. Now, I wasn't guaranteed anything. They wouldn't die. After Gabriel died, my son overdosed 8 times. But I still wanted to know how to work with this and what I needed to do. I also joined some online support groups. So I always tell people, you get help for yourself and you get help for your child as well. But you need help as well. You need recovery too. And then I also consulted with my insurance provider about just some different what they cover and what they don't. But I wanted to talk with you about your child. The information, there's a lot of information out there, like for the parents of drug-free kids. It's excellent, excellent, excellent material. You can go and you can call their toll-free number that's up there on the screen, 1-855-378-4373. They have 24/7 parent addiction coaching available, and they train them. And you can call if you have if you need to make a plan for your child, or if you're not quite for sure what to do or how to get help, or at what extent does your child need help, they can guide you, and they have absolutely wonderful resources to what to do if your teen or young adult has a problem with drugs. And there is a lot of fear with people of all ages. When you have someone with a substance use disorder, they have a fear of what's going to happen if their drugs are taken away. And then what's going to happen if I actually am drug free? But the thing that your teen or your young adolescent is going to need is professional treatment and support from you. They need to be in a safe and a comfortable environment. Possible detox might come, that might be needed. But the thing that your teen needs to know is that you love them, and that you're going to stand by them, and you're going to find them support. So, and then asking for help from professionals is going to be a big key. It's going to be a big step. And you can take your child to their pediatrician, to their doctor. They can do assessments. And if they can't do the assessment, they should be able to refer you out to an appropriate provider, an appropriate person to do some type of an assessment. You can contact an addiction specialist directly. There are over 3,500 board certified physicians across the United States who specialize in addiction. The American Society of Addiction Medicine is an absolutely wonderful resource. They have a Find a Physician feature. They have on their homepage, if you do Find a Physician feature on their homepage, you can begin to look at what's available in your state or your city. The American Academy of Child Psychiatry has an adolescent psychiatry finder as well for you to find a psychiatrist for your child. And you can go to that website there, and you'll get this presentation. And so you and your physician can decide if your teen or your adult, what should be the referred treatment for them. You know, it takes a whole lot of courage to seek help for a child with a possible drug problem. There's a lot of hard work for you and for them. It can interrupt school, personal goals, athletic milestones. But let me encourage you, treatment does work, and teens can recover, and young adolescents can recover, but it's going to take time. It's going to take patience. Treatment enables young people to counteract those addictive, powerful, disruptive effects that have happened in their brain and their behavior, so they can hopefully regain control of their lives. And you want to make sure they're as healthy as possible with getting them the help that they need. Now, in the next part of this, I do want to talk about the steps that you're going to take. You're going to talk with your child about the substance abuse. Is the child open to getting help? Exploring your options. What is right for you? How are you going to figure that out? Does your child have insurance? How are you going to find a provider? Do they need treatment? Do they need inpatient? What's the continuum of care going to look like? And all that being said, all these steps, there's a lot of resources out there. One of the resources that is excellent that is on one of your handouts is called Your Child's Treatment Roadmap. Because the road to recovery isn't the same for everyone. There are options that you have to consider for your son, your daughter, your loved one, whoever that is. But their guide outlines key steps to help you make that right choice for your child and for your family. And it might come in the form of formal treatment. But as you navigate this, know that they'll help you. And you can, like I say, refer back to that 1-800 number. But when you look at the steps, and when you look like, have you talked to your child? It'll ask you, yes, I have. And then it moves you to this algorithm, or no, I haven't. So if you haven't talked to them yet, they will, in the handout, it will give you tips and having more constructive conversation with that child. Or if you suspect that they're using, there's a link there to learn how to detect those early signs that we already talked about. And is your child open to getting help? And if they are, know what your options are. If they're not open, that's not uncommon. They give you advice and motivating them to explore the treatment. And then the other question you have to ask is, has your child received treatment before? And if so, do you need a new assessment? And when you explore your options, you want to educate yourself about the different treatment options that are out there. They're not the same. A detox is not recovery. A sober house is not a recovery house or a rehab. So what is the appropriate level of care that your loved one needs? Are they going to just get counseling from the assessment? Are they just early on and maybe they need some counseling? Maybe they have a dual diagnosis. Maybe they have depression or anxiety. Do they need the intensive outpatient program, which that usually involves residing at home with going maybe 6 to 9 hours a week at some type of a programming. They do also have what they call partial hospitalization. Do they live at home? Do they need maybe 20 or more hours? Do they need counseling options? That can vary along the way. Do they need maybe residential? Do they need to maybe consider that they need 24-hour structure and maybe at least 5 hours of clinical service a week? I mean, what is their need? The length of your child's stay is going to depend on the severity of their substance use disorder, as well as your insurance or the ability to pay, sadly. But there are places, I know in Kentucky, I don't know about the other states, but there are free places, there are 18 free places here in Kentucky. Then there are scholarships. So, and then what about this? What about inpatient? Let's talk about medical services as well. And then once stabilized, maybe moving them to a lower level. Or is it possible that your child might need medicated assisted treatment? If they're using opiates, is Vivitrol an option for them? I mean, what about Suboxone? What about something that might help them to function until they can get to where they need to be in their recovery? So I do want to say this about a detox reminder. If you have someone that's using alcohol and benzodiazepines, they will require a detox that's medically supervised. Now, I tell people, both of my adult children that are in recovery went to medical supervised for opiates, and I just think that's the humane way to do it. But anyway, just looking again about what's right for you. Try to schedule the assessment for your child to determine the best possible care. And if that's not possible, there are certain considerations that can help you make the right decision. Their assessment, I would use, be really careful. And I say this, be really careful about people that say, hey, we have free assessments. They're likely more about attracting new patients, or maybe not so much about determining what's actually the best for that child. I'm not saying that about all of them. I'm just saying that just be careful. I discourage people from calling the 1-800 number on TV with the guy around the stethoscope around his neck. Or if they offer you to fly you somewhere for free, be really leery. Look at those credible sources like SAMHSA or the ASAM directory, that addiction specialist, the ASAM directory there, the Psychology Today, things like that. But assessments, which are typically conducted by private providers, might include a comprehensive clinical evaluation and a substance use screening. So these are used to determine the level of care that's appropriate for the person that you love. And an insurance usually will cover this, but there are additional costs as well sometimes. But you might want to consider some other things as far as making the decision for your child. What about your insurance? What about the coverage? What about the distance from home? Do they have a co-occurring disorder? School, family, work, aftercare, what is being offered? And is your child insured? And if they're not, then don't worry. There's still options out there for you. But if they're insured, you're going to have to explore your insurance coverage. Now, your insurance coverage and your child's insurance coverage may be different. Understand that there might be a difference there. So that's something you're going to have to check with. Now, if your child doesn't have insurance, there are a lot of state-provided services. SAMHSA has a locator. There's addiction counselors on Psychology Today. You can call the Drug Partnership for Drug-Free Kids. There's Smart Recovery. There's other support groups. There's Favor Greenville for families. There are other places that have scholarships and sliding scales. But just know, obtain whatever information that you need to find that right treatment once you get the assessment. And remember, you can call anytime for that resource at 1-855-DRUG-FREE. And that's with the Partnership for Drug-Free Kids. And then again, starting the treatment and then making sure that your child signs a release form so you can stay up to date, so you have access and they can freely talk with you. But the journey doesn't stop at treatment. It continues on with some type of continuing care. So support groups, recovery coaching, counseling, whether it's going to be a living situation. Do you have naloxone in case they relapse or use again? Most states will allow you as a third party to carry it. Structure, family support is going to be a big deal. So just know that there is treatment out there, and it's a learning process, and we're to help you here. We're here to help in any way that we can. Anyway, thank you again for being here, and I will turn this over to Mary Beth. Thank you, Mary Beth.
Thank you, Arlene, so much. Your information was wonderful, and what we're going to do is just wrap up a few slides here and then open it up to questions that have come in. Michelle will take over at that point, and Arlene, just hang on.
Sure.
I just want to let everybody know that we do have another webinar coming up on Tuesday, June 5th from 2 p.m. to 2:45, and that is with Kimberly Hinkle, and she is with the organization SOS for Addictions, and it is on addiction in the family. So she will be talking about her own personal experience, but also some of the trauma that kids experience because of addiction within their own family. Couple of things to keep in mind. If you are new to Operation Parent, we just encourage you to like us on Facebook, and we do post on there very often with articles and different links that would be very helpful to you as a parent or to a coalition or to your parents of your students. Sign up for our e-newsletter or purchase a parent handbook. And we have a variety of parent handbooks available to you. We have parent handbooks on the elementary version in English, Spanish, and a Christian edition, and as well as the high school, middle school edition. Just so you can see, this is the table of contents from our high school and middle school editions, and it's quite robust, talking about trends, misconceptions, and warning signs, and where can I go for more help on any of these topics. And lastly, we do offer community presentations. I am the presenter for the community presentations and have traveled for the past 7 years talking to students, parents, caregivers, teachers, counselors, at conferences, at schools, businesses. So if this is something you would be interested in learning more about, in the survey, you can go ahead and put your information in there, and we will contact you and let you know how that all works. And then again, this is the thank you from us. This is how you can reach Operation Parent and our phone number. And I'm going to go ahead and turn this over to Michelle to pose questions to Arlene.
Okay, great. Mary Beth and Arlene, our first question in the queue is, what are some ways to help prevent addiction? What are your recommendations to stay in front of addiction?
Hello. Okay. What are the ways to help prevent addiction? I think with, hello, Beth?
No, you're there. Go ahead, Arlene.
Oh, okay. I didn't know if you were answering the question. I kept hearing.
I was going to let you go first.
Well, I think a lot of what's going to have to do with prevention has to do with education. I think a lot of it has to start in the younger years. One of the mistakes that I made, I think, along the way was not talking with my children when they were younger about drugs, even though they had drugs in school, but there was no prevention education for them. So I think one of it is going to be advocating for education in the schools at a very, very young age, 4th, 5th grade even, in elementary school. I think that's going to have a big impact in how we're going to help prevent addiction.
I agree with you, Arlene. Another thing is to really, in educating yourself, educate your children, like Arlene said, but inside your home, really just pay attention. And when they are going out, where are they going? Ask those age-old questions: who, what, when, where, why, and set curfews. Be awake when your kids come home, your teens come home in particular. Don't give up and say, well, they're going to be home at a 1 o'clock curfew because that's what we've said, or they're going to blow through the curfew. Set the curfew, enforce the restrictions with it, but more importantly, be awake. So when they walk in that door, you're going to have a conversation with them. Look at their eyes, smell them. Have a conversation. Bill Oliver, who did the Parent for Parents series, says, give them a big hug, pop them one, so they exhale and smell their breath. But the point is, you want to give them a reason to say no. And if it's because my parents will be awake when I get home, that's the reason. But you are going to be the reason they say no as much as you can. But ultimately, they are going to make choices. And that is where the education comes into play, and giving them a reason while they're in your home to say no.
Or even giving them scenarios
Yes.
where you're talking about this may come up if you're out in a group. Have a plan of
Yep.
if somebody says, hey, take this, and educate them about what's out there and some of the scenarios that they may come into play with, even with friends that they hang out with. But again, because of the risky behavior in teenagers, I think we have to start early with this might happen at some time in your life and be able to openly dialogue with them about some scenarios, I think.
Yeah, great ideas, Arlene.
Okay, great. Our next question folds right into what we're talking about. One of our guests is looking for a tool to use, either print, video, or online, that they can introduce prevention to children in elementary school. Can you think of any resources?
I think of Operation Parent. You know how to work for Operation Parent. They have a great resource. Seriously, guys,
Yeah.
some of the best material out there you're going to find on Operation Parent, whether it's with the videos or little short snippets or with the Parent Education Handbook and how you can use the tool that's in print. That's my go-to. When I have parents that ask me, I send them to Operation Parent's website or tell them about the handbooks. And they even have a Christian edition as well that you could even utilize for youth ministries or in churches. So and I'm not just saying this to promote Operation Parent. I'm being very serious here with some of the best resource material you're going to find is going to be through Operation Parent. There are some other ones that you can go through, like the Partnership for Drug-Free Kids or NIDA for Teens. It's NIDA for teens is another one, but the Partnership for Drug-Free Kids has buku's amount of videos, printed materials, things online that you can tap into as well as the National Institute for Drug Abuse, NIDA.
Yeah, they're great resources, Arlene. I would say Partnership for Drug-Free Kids. Also keep in mind our community presentations are available for elementary school also, and starting that discussion about alcohol, having conversations with our children about alcohol, where is it stored in your home, and how you model the behavior for their usage also. But we do that through community presentations, and as I mentioned before, you can contact us, and we do travel to go out and do presentations.
Yeah, and getting back again to that, the Partnership for Drug-Free Kids, they actually have a resource page, and it's pretty awesome to go there and to look at the different things that you can access there.
Okay, great. Thanks, Arlene. Our next question is a statement and a question. So it's regarding my adult substance using daughter. I'm having trouble determining when I might be enabling her and when I am being supportive with setting limits. Can you give me some suggestions?
I think one of the things that I ran into was the enabling issue with my own children. And I always think of it like this. When you're enabling someone, it will always have to do with money. So you have to decide to create what boundary that you're going to have there. I think a lot of times parents love their kids and people say we're enabling, and enabling is subjective to a lot of different people. It might be not be the same definition for you or for me. But I think that one of the resources you might look into for a support for you would be what we call PAL groups, Parents of Addicted Loved Ones. They have all kinds of resources. They meet in different states across the country. You can go online to the PAL groups and see where they might have a host place in your city, and they provide all the resources. They help you to set boundaries. They help you come up with a contract, a plan, and then you also are with other parents who are dealing with the same thing that you're dealing with. This is what I used early on after Gabriel died, the parent addiction coach, but now it has spread. It started in Arizona, but now it's in several states across the country. But I would encourage you, if you have an adult substance use with a substance use disorder, to plug into maybe a PAL group in your community. And if you don't have one, you can always start one and they'll show you how to do that. But to set those limits, that's going to have something that you're going to have to work with, because that's really broad. I mean, are you going to let them come home? Or are you not going to let them come home? Are you going to give them a bologna sandwich if they're hungry? I do, you know, but just realize that cutting off money, I think, is saying, no, I'm not going to give you money, or whatever. But I think it's something that you have to journey on yourself, and everyone, it's not going to be the same for everybody else, but if you are into a PAL group, they can help you to make that decision that's best for you and how to continue to support your daughter and continue to love her in that, despite the fact that she's still using.
Okay, awesome. Thanks, Arlene. We also have a guest that recommended the resource NAR, N-A-R-Anon, A-N-O-N. Are either of you familiar with that resource?
I'm not. Marlene, are you?
I have heard of Naranon. I'm not real familiar with it, but I'd be certainly open to looking at that.
Okay. Thank
Is it
you.
a treatment center? Is it a support? Is it like Al-Anon or?
Just in a quick Google search, it's 12-step program for friends and family members who are affected.
Okay.
So I would definitely
Sure.
let folks check it out. Thank you for the suggestion from the audience. We'll take it. We'll take them. The last thing I'm seeing in the queue here is a thank you to both you and Mary Beth for the wise and encouraging advice.
Oh, thank you. Thank you for
you.
being here. We appreciate that. Thank you.
All right. Well, we're going to go ahead and wrap up, and thank you so much, everyone who attended the webinar today. And as I mentioned, there will be a short survey that'll be sent to you as soon as I close this down. The recording will be available tomorrow. You'll get the email around 3 o'clock tomorrow, and then a separate email will come to you that will have all the handouts attached in case you did not download them while we were in session. And Arlene, I just want to thank you so much for being here and sharing your story and your information, because it's priceless and so helpful. And Michelle, thank you for working the controls today. And we're going to go ahead and end our webinar today and hope to see you at our next one on June 5th. Bye-bye.
Thank you. Bye-bye. All right.
Okay, hold on.
Hey, Mary Beth, you there?
Yeah, hold on. I'm just, I'm sorry. There was I couldn't figure out how to, I usually get a pop-up that says audience leave or your leave, you know what I mean? Yes. And I didn't get the pop-up, so I probably missed it. And so I had to shut it down. Okay. That's good. I can still see it. Okay, good. But there's no one can hear us for sure, right? No. We're all the way out. Okay. I'm a recovered heroin addict. I say recovered because in 2012 I was living in Washington, D.C. when I overdosed while at work. I was in a coma for almost a month and have had brain injury because of it. And since I was in the hospital, I wanted to give back. Wow. Let me call Arlene because I know she was trying to talk to me. Yeah, Cassidy Pierce is the person who put that up there. Cassidy. Wow. Okay. All right. One more in the books. Good job. Yeah. One of my good volleyball friends posed the first question. Oh, really? Yes. I'm looking for the phone, and obviously the phone is not here. Yeah, we're done. We got real close. We were at 96 at one point. Wow. That's awesome. Yeah. I hated to kick you guys off, but I was watching the number grow.